What really defines a senior citizen? Is it age, lifestyle, or something deeper? Let's uncover the truth together. Senior citizens, often referred to as elderly, represent a unique phase of life with many challenges and questions. As people transition into their senior years, they often face health challenges, financial concerns, and lifestyle adjustments. Senior discounts are more than just perks. They provide essential support to those on fixed incomes striving for happiness. Housing options for seniors vary, allowing anyone from independent individuals to those needing full-time care to find their fit. Understanding financial planning is crucial, as insufficient savings can turn retirement dreams into daunting realities full of stress. Navigating legal matters and ensuring protection can help seniors maintain dignity, independence, and peace of mind during vulnerable times. When you hear the term senior citizen, what comes to mind? Does a person have to be over a certain age to be a senior? If you are reaching the later stage of life, these are likely to be some of the questions you have asked. To provide clarification, here is everything you need to know about becoming a senior citizen in the U.S. Did you know? You might be missing out on tons of discounts and freebies that are available to you as a senior citizen. Senior citizens are also known as elderly persons or simply as seniors. Categorically, a senior citizen is a social demographic based on age. Being a senior citizen typically means that a person is at the age at which they retire from work. They are transitioned from a working adult to a retiree. What does it mean to be a senior citizen? An elderly person in the U.S. is typically considered wiser or more experienced. Culturally, a senior citizen is someone who is slowing down in their life. They have accomplished raising a family, having a career, or any other monumental feat in their adult life. Economically, a senior requires financial support, either in the form of retirement funds or savings, or with the support of a caregiver. As a result, seniors are often dependent on others for their welfare. Medically, a senior citizen is more apt to have health problems, which are age-related. Loss of mobility, hearing, and vision are the most common health complaints. At what age are you considered a senior citizen? The age of a senior citizen varies according to the source. For example, according to Medicare, a senior is 65 years old or older. However, Social Security benefits are eligible for seniors starting at 62, even though the Social Security Office reports that 67 is the age of retirement. In general, however, once you turn 55, you start to enter the senior age demographic. By the time you are 65, you reach the most common age for retirement from your job. Seniors are on fixed incomes and often with limited assets that are to last for an unknown number of years. Yet seniors need to be able to live a healthy, happy life in retirement. To help seniors afford both the essentials and the extras, companies offer discounts for this age group. What are senior citizen living and care options? There are three main types of senior citizen living and care options to consider. Seniors typically live at home, either by themselves or with a caregiver, or in a senior living apartment or retirement community. A senior citizen who can live on their own at home requires the lowest level of care. In some instances, these seniors will have caregivers who live with them. In most situations, but not all, a caregiver moves in with a senior citizen when they start to have trouble with daily activities. If a senior is either unable or unwilling to live alone, they will typically transition to a senior apartment within a retirement community. Seniors live in their own apartments or single-dwelling houses within the retirement community. They are provided with specialized services that allow for a low to medium level of care. More importantly, within an active senior retirement community, elderly citizens are provided with a network that allows them to socialize. Being alone in one's home is often the first issue of living as a senior. By moving into a retirement community, seniors can overcome this roadblock and continue to thrive in a supportive environment. A retirement home includes an assisted living facility and a nursing home. This type of senior living is reserved for seniors who cannot handle day-to-day activities and care for themselves. They require 24/7 medical care and observation to ensure they do not suffer due to neglect or lack of proper medical providers. What are some financial matters for senior citizens to consider? In terms of finances, seniors are at the end of their working career. If a senior has planned accordingly by saving for retirement throughout their adulthood, then they should have the funds available for retiring. If they did not plan ahead, then working is likely a necessity. There are the options for taking Social Security benefits and getting Medicare health insurance as a senior, both of which help with senior finances. However, most of the time the SS benefits are not enough to live off of. In addition, Medicare coverage does cost a senior each month. It is not free healthcare coverage. What are some legal matters for senior citizens to consider? In addition, a senior citizen should determine an executor of their estate. This person becomes responsible for making legal, medical, financial, and other such decisions for an elderly person if they become incapacitated or no longer have sound judgment. Finally, a senior should speak with a lawyer if they feel they are being treated unfairly or discriminated against. Having an attorney who can be reached for legal advice or protection can help a senior live a happier, healthier life. What are senior citizen health insurance options? Insurance coverage for seniors ranges from private health insurance coverage to public health care. If a senior citizen has private health insurance from an employer or third-party agent, then this should be sufficient to cover most healthcare needs. However, for seniors who have retired from work, they may be without health insurance. This is where Medicare comes into the scene. Medicare is a federally provided social health insurance program that is open to all seniors 65 and older. Once a senior turns 65, they have an enrollment period of 7 months. For seniors who enroll later, they are subject to a penalty. Thanks for watching the Senior News channel. Like, comment, and share. Hit the subscribe button and never miss a new video.